Hi, how's everyone? I'm Dr. Lam here from Island Hospital. We posted our Facebook Live advertisement maybe like a few days ago, and I've received quite a number of questions. So at this moment, of course, we are discussing about COVID-19, and I will go through the questions one by one. The first question that I got is how far can respiratory droplets from one infected person in travel? So is social distancing enough to keep me safe? Well, if you see, social distancing is advised by the different countries, with different distances. As for Malaysia, maybe you have heard that the government advises us to keep 1 meter distance from others. Well, in other countries, some actually advocated to 2 meters. But is this enough? Well, this 1 to 2 meters basically safe if like these two persons, they are standing still, not talking. There have been researchers saying that if you are walking, if you are running, now even if you are cycling fast, the droplets can travel even further. For instance, if you are actually doing hardcore the jogging or cycling hard, then the droplets can actually travel up to 20 meters. So at the moment, if you want to go out cycling or jogging as allowed by the government, then remember to keep your distance. Um, Also, the lately our DG Dr. Noor Hisham actually asked us to avoid 3 Cs if you are going out, in which you may need to avoid confined spaces as droplets can be more difficult to dispose in confined places such as aircon places, crowded places with many people, and also to avoid close contact with one another. The second question has been, I heard of, yeah, that COVID-19 is spread from animals like bats, but can it also affect other animals? The person asked, would I get COVID-19 from eating other animals like chicken? Well, according to researchers, yeah, traditionally we believe that coronavirus, especially those that we are very much scared of, which is human coronaviruses. They are initially originating from the forest. Yeah, the bats are carrying it, and unintentionally they actually has transit animal like civet cats, camels, or sometimes cows before the viruses has been transmitted to human. Then after all, human to human transmission. So as is this context, at the current moment, we haven't found any domestic animals transmitted the disease to human. At the current moment, I would say it is safe to eat like the meat you like or the chicken you like. Then, but just remember, if you are eating anything, you better cook it properly and cook it thoroughly. There's another person actually asked, how can I tell the difference between COVID-19, flu, cold, and fever? Well, we know that all these symptoms are similar and they are sometimes not almost the same. Yeah, that's what I will tell. Unfortunately, you can't differentiate clinically or you can't differentiate by symptoms whether this is COVID-19, whether this is flu, or whether this is just a common cold. That's why at the current moment in dense area in red zones, then we have been actually advocating for a widespread or mass testing. So yeah, if you have a flu, if you are feeling unwell, if the symptoms are mild, so the advice from doctors to the public is watch your symptoms, observe your symptoms, keep the social distance, stay away from other people, and also maybe your family members. If the symptoms are not getting better, go and have the test and go and consult your doctor immediately. Okay, so this is another question about mask. we know that mask is not very freely available now because the stock is low. So if someone couldn't purchase mask that which of surgical quality, so can other masks like cloth mask, sponge mask be protective? Well, if we look at what it is available in the market, we have like surgical masks, we have actually medically used masks. Sometimes you can see also people wearing cloth masks or even scarf. So are all the same? Well, I'm afraid to tell that not all the same. So if you can see from the illustration here, we have like N95, we have FFP1, which is should be reserved for medical use, yeah, for doctors. And the one commonly advocated is the surgical mask, which is mainly green in color or blue in color. So all these N95, FFP1, and surgical masks, they actually pose a high protective effect. Whereas your other masks like cloth masks or your sponge mask, they are actually having low protective effect. So are we going to say that if you don't have surgical mask, then you can't wear other masks? Actually, the answer is no. By right, you should actually still wear your mask when you are going out. If you can't get a surgical mask, please also wear other material such as cloth mask or your sponge mask, because by wearing any piece of paper or cloth or anything in front of your nose and mouth, you can actually help to prevent the infection by spreading to other people if you are having the infection. So if everybody going out to the public with a mask on their face, no matter it is a surgical mask or a cloth mask or the sponge mask, you can actually help to prevent the transmission in the community. Okay, so there are also some measures you need to actually observe when you are wearing mask. The mask should be wear properly to cover the nose and mouth. So this is actually a picture to show that the mask is not worn properly. And again, when we wear the mask, we shouldn't actually touch the outer surface of the mask, because the outer surface of the mask is presumably contaminated. So to wear a mask properly, the mask should have covered the nose, the mouth until the lower chin, and the area on the nose bridge to be actually pressed firmly against the nose to reduce any space in between. Right. The next question. COVID-19 is known to attack the lungs. What about other organs or systems in the body? So in severe cases, yeah, so only in severe cases, we find that COVID-19 can affect other organ systems as well, apart from the lungs. So such as kidneys, liver, the gastrointestinal tract, which is the bowels, the circulation, and also maybe the brain. So in terms of death, most of the time the death is actually due to multi-organ failure. So there was a question on how effective are those virus shut-up personnel protection devices, yeah, such as maybe earlier in the phase you had heard of sodium hydrochloride, patch that we wear. Some people actually wore to protect themselves from viral infection. Well, at the current moment, there is no such evidence to show that there was an effective viral shut-out protective devices. And even at the current moment, there's no evidence of supplement or traditional remedies that could help to prevent viral infection. Okay, so besides washing my hands, practice social distancing, wear a mask, is there anything else I can do to prevent the virus? Okay, so this is a very good question. We have done a lot, to help us in not getting the virus into the body. But is there anything that we can do to enhance our immune system? Well, there are some ways that we can use to build our immune system using 3Cs. Yeah, earlier on I've been discussed on how to avoid 3Cs. Right now we have another good 3Cs. Okay, so this include care, good, and clean. So we have to take care of ourselves by sleeping well, regularly exercise, and then maintain a good mental health. Yeah, stay happy because good mental health can actually make the body strong as well. So and we are also advised to cook at home, try to eat healthy, try to have balanced diet, and also not to forget personal hygiene, because if we do all these things together, if you have a rather good immune system, rather strong body, then in case we are unfortunately getting any infection, it can be actually healed faster, and we can actually prevent ourselves from getting serious complications. So yeah, this is a question into the treatment. Can antibiotics help? So unfortunately, this is an viral infection. This is not a bacterial infection. So specifically saying antibiotics doesn't help. So of course, at the current moment, our doctors have been trying to treat patients with multiple combinations of drugs, including some antiviral, including maybe you have hydroxychloroquine, chloroquine, but all these drugs, they are still under observation usage. And at the current moment, there is no such a thing called as a magic bullet or magic medicine or magic pills to treat COVID-19. However, in cases with secondary bacterial infection after obtaining COVID-19, and mostly in severe cases, sometimes antibiotics can be used by the doctors. Okay, so yeah, the following question is what will happen to my lungs after I recover from COVID-19? Is it true that I will lose around 40 to 50% of my usual lung function? Um, COVID-19, yeah, we have actually a spectrum of the disease. So it can range from mild disease to pneumonia, which is lung infection, then to severe diseases. So for mild diseases, most of the time people recovered without maybe observe long-term consequences. But then there are cases who discharged from ICU who actually sort of partially recovered with lung scarring. So, but anyway, this is a new disease, and the long-term consequences and the long-term complications of it still yet to be studied. Right. Um, So yeah, someone asked regarding problems with the lungs or breathing. Yeah, so if like the person is someone with a history of asthma or breathing problems, is the person at higher risk of developing a fatal case of COVID-19? To answer this question, I will actually divide the lung problems into those acute or chronic lung problems. For acute lung problems, for instance, for asthma, right? Uh, Asthma patients, they are actually having normal lungs at baseline. Yeah, so they are asthmatic. Then they will have only lung problems when they are having flare. So if they are truly only having asthma, when they are well, their baseline lung function is actually should be the same as a normal person. So in fact, asthma patient likely, if they have their disease controlled at a good baseline, their risk should be actually same as the normal public. But most of the time, what we see now is our asthma patients are also smokers and have other concomitant problems. So yeah, if the asthma is not well controlled and there are other additional problems, yeah, so the risk is actually at higher. This happen with other patients such as patients with chronic lung diseases, lung fibrosis, and also smokers' lungs. Yeah, so these patients, if they are catching COVID-19, they are actually at higher risk, yeah, to develop severe disease. So, as a respiratory doctor, I will advise all the smokers out there to please stop smoking now, because smoking actually increases your chance of getting a severe disease if you are infected with COVID-19. Right. With the um, send in questions that I managed to prepare. Right now also I have actually few incoming questions. So some questions are coming in with Malay language. Yeah. So yeah, let me answer these questions in Malay as well. Yeah. So there's a question from Mr. William. Ya, ada satu soalan daripada Bapak William, ya. Dia tanya tentang kalau ibu dia ada diabetes, hip replacement, dan sering mendapat pneumonia dan bronchitis. Ya, macam mana perubatannya? Okey, jadi untuk pesakit yang ada diabetes dengan hip replacement, kami rasa pergerakannya agaklah sukar, jadi banyak duduk. Jadi kalau seseorang itu banyak duduk, masalah paru-paru itu akan lebih kerap menjadi. Jadi untuk kes macam ini, kalau seseorang itu kurang bergerak, ya, jadi imun sistem badan itu akan jadi agak rendah, ya. Jadi jangkitan senang nak masuk. Untuk pesakit-pesakit macam ini, yang penting itu sedikit sebanyak exercise kena dibuat dengan pergerakan tangan, pergerakan nafas, dan juga kalau pesakit itu sering mendapat jangkitan paru-paru, doktor akan menasihatkan cuba mendapatkan vaksin untuk menghindarkan masalah paru-paru yang akan datang. Jadi di samping itu pemakanan dan imun sistem badan pun kena dijaga. Lepas itu mungkin ada satu soalan daripada Bapak William juga, ya. Macam mana nak bebas daripada penyakit paru-paru dan kanser paru-paru? Ya, ini adalah satu soalan yang umum. Secara singkat, apa yang boleh saya beritahu ialah buat masa ini satu-satunya kegiatan ataupun satu-satunya yang keadaan yang kita boleh nasihatkan untuk menghindarkan penyakit paru-paru dan kanser paru-paru ialah jangan merokok, ya. Ya, ada tak soalan-soalan lain? Oh ya, Encik William lagi sekali, ya. Jadi bagaimana untuk menjaga kesihatan paru-paru? Jadi sekali lagi, utamanya jangan merokok, dan kemudian juga seperti saya yang cakap tadi, banyak exercise dan mengamalkan pemakanan yang sihat. Apakah yang menyebabkan kerosakan paru-paru? Jadi pada masa ini, ya, sebab dunia kita semakin mendapat banyak kegiatan, ya, aktiviti pencemaran udara. Jadi pencemaran udara ini banyak boleh menyebabkan kerosakan paru-paru. Selain tidak merokok, jikalau kawasan itu teruk dengan pencemaran udara. Jadi mungkin apa yang kita kena buat ialah bila keluar daripada rumah, cuba pakai mask. Dan selain rokok, selain pencemaran udara, asap-asap daripada pembakaran arang ataupun asap-asap daripada pembakaran corot masa sembahyang pun boleh menyebabkan kerosakan paru-paru. Jadi untuk wanita-wanita yang memasak menggunakan arang, ya, ini kita akan nasihatkan supaya jangan memasak di dalam rumah, cuba memasak kalau nak gunakan arang di tempat yang luas. So there is the other question from Lenny, yeah. So hi Lenny. So the question was, can people get reinfected after they recover? So this is actually a question like commonly asked by doctors also, because we are so worried, if we actually discharge the patient from the hospital, then probably they are not well enough to go back to the community, so they might get the infection and then disseminate the infection to the community. So at the current moment, when we treat our patients, we will actually make sure the virus test be negative first, yeah. So we use RT-PCR to test for the virus. Yeah, so if the RT-PCR is negative, then only we discharge the patient from the hospital. So of course, if you look into the cases in other countries, there have been people having RT-PCR positive back when they are discharged to the community. But so far, we don't really see any community transmission yet for those people has been discharged back to the community. So in that case, the scientists and also the doctors actually believe that the virus, although it's detected in RT-PCR, but it may be not a viable virus anymore to cause infection. But yet, this is a new virus, yeah. So at the current moment, it is actually still difficult to say whether it is how will the condition turns up later. Then, but anyway, for those patients has been discharged back to the community. Upon discharge, we do advise for 2 weeks of quarantine first before they resume their full activities. So this is question for Erica, yeah. Oh, okay. So there's another question on apa perlu pakai mask tiap-tiap hari seperti di Jepun, ya, untuk terhindar daripada polusi dan menjaga kesihatan. Jadi sekarang apa yang kita kena buat ialah mungkin bukan seperti dulu. Seperti kalau kita pergi seperti dulu, kita boleh keluar mana-mana, kita boleh pergi makan di restoran, kita boleh keluar jalan-jalan, tengok wayang. Tapi selepas COVID-19 pandemik ini, kadang-kadang kita kena fikir, ya, kita perlu adopt kita kata sebagai new normal. Apa itu new normal? New normal ialah keadaan pergerakan kita mungkin sudah lain daripada dulu. Jadi untuk masa sekarang, kalau kita tengok kebanyakan negara, ya, mulai menasihatkan rakyat-rakyatnya supaya jangan keluar daripada rumah jika bukannya terpaksa. Jangan pergi ke tempat yang ada orang ramai. Jangan pergi membuat kenduri ataupun gathering kalau tidak perlu sangat. Malahan ianya memang tidak digalakkan dan tidak dibenarkan di setengah-setengah negara. Jadi kalau terpaksa juga pergi keluar, anda semua dinasihatkan pakai mask dan apa-apa jual mask pun boleh, tapi pakailah sesuatu untuk menutupi hidung dan menutupi mulut anda. Jadi ya, Annie Hong, ya, hi Annie. Annie tanya tentang kenapa tiap pagi hari mesti batuk dan sudah siang tak batuk lagi. Ya, ini mungkin tidak berkenaan sangat dengan COVID-19, tapi apa yang kita tengok dengan batuk ya, kalau dengan batuk, tujuannya badan menjadikan kita batuk ialah untuk mengeluarkan dahak supaya dia tidak blok pada salur pernafasan. Ya, dia tidak mengganggu nafas. Jadi kenapa pagi batuk tetapi siang-siang hari lepas tu tak batuk? Jadi pada biasanya paru-paru kita akan menghasilkan dahak pada kadar yang lain. Jadi pada siang-siang hari kita sedar dan dahak yang dihasilkan itu kita boleh telan masuk ke perut. Tapi masa tidur, pergerakan sudah kurang, jadi dahak yang disediakan akan berkumpul di belakang kerongkong dan itulah sebabnya bila bangun pagi, dahak macam semakin banyak. And the next question is Kevin Chia. Yeah, Kevin Chia asked whether the lungs will be fully recovered. Yeah, if not, then what's the percentage of damage? Okay, so I think this is a question that maybe Kevin wished to ask regarding in case a person is infected with COVID-19. Yeah, so for COVID-19, the disease actually having a spectrum of presentations. Yeah, it can be from a mild disease to a lung infection and also to severe lung infection and multi-organ failure. So in mild diseases, so far that what we have seen, if the lungs are not involved, so you can't really get any sequelae from the patient who has recovered. But some patients will be admitted to ICU, then they will have actually different degree of lung damage. So some of them can develop lung scarring, which is actually what we call as a lung fibrosis. And depending on the severity, so it actually will probably affect the lung function and the patient will have actually breathlessness and reduced exercise tolerance during recovery. But how long this situation will last and will the patient improve to maximum health? This is still a bit early to say, yeah, because the disease is actually very new and then our doctors and our scientists, they still need time to study this disease. Okay, so because actually in Island Hospital, we have quite a number of patients from Indonesia. And so yeah, so I finally get to hold to Erica ya. Hi Erica, sorry sebab doktor tidak nampak soalan tadi ya. Jadi Erica tanya, kalau ubat sudah habis dan tiada di Medan, macam mana nak buat? Okey, doktor berasa sangat sedih ya pada masa sekarang sebab border kami sudah lock dan untuk keselamatan bukan sahaja kami di sini tapi untuk keselamatan ya kawan-kawan di Indonesia, kami tidak dibenarkan pergi sini ataupun pergi sana ataupun datang melangkau border. Jadi memang susah untuk jumpa doktor di sini pada masa sekarang. Tapi untuk masalah ubatnya, doktor faham. Jadi apa yang Erica tanya, Erica boleh pergi ke email Island Hospital. Mungkin boleh pergi ke Facebook ataupun pergi ke website ya untuk Island Hospital sebab kami akan sedia membantu sebab kami memang ada ejen di sini untuk bantu beli dan kirimkan ubat. Jadi informasinya ada di Facebook Island Hospital ataupun di website Island Hospital. Okay, Lenny ask again regarding that it is true that COVID survivor blood plasma can be used to cure other COVID patients. Wow, this is actually a very brilliant question, yeah, Lenny, because doctors ask these questions. Okay, so yeah, so convalescent plasma, in other words, yeah, convalescent plasma means the plasma that we harvest from patients who have recovered from COVID-19. So these patients are no longer infective, but then their bodies actually produce antibodies, which we doctors believe might be helpful in treating the patients with severe COVID-19 diseases. So this treatment has been actually studied and so also have been carried out with in certain countries, yeah, to treat the severe disease. So whether it truly works or not, okay, so we will let the studies and then the research to tell us. So far, as I mentioned earlier, at the current moment in our world right now, globally, we still don't have um, one magic bullet or magic pill, yeah, to treat COVID-19. So we hope for the best, and then yeah, my assistants besides me, yeah, already remind me that no, my time is up. So well, I'm actually very happy, to have this session to share with my audiences from the Facebook. In fact, this is my first time doing Facebook Live, and hopefully that this is a successful one. And then thank you for the questions, and I hope that my answers actually satisfy you. So till we meet again, maybe it is really useful, then we can actually make it happen next time. Yeah. Bye.